I'm Dr. Joel Campbell, one of the orthopedic sports medicine fellows at the Steadman Hawkins Clinic of the Carolinas with Greenville Health Systems. I grew up in a small farming community in central Illinois, did my undergrad at Augustana College in the Quad Cities, Illinois, and then went up to Chicago for medical school at Rush. Then went to Nashville, Tennessee to Vanderbilt University for my residency. An orthopedic sports medicine fellow basically means that we've finished our training, we could go out into practice, but we've chosen to do an additional year to subspecialize in the field of sports medicine, kind of to hone our craft, develop a skill set, and really to develop a mentorship relationship with some of the surgeons here at our fellowship, so that going forward the rest of our lives we have someone to communicate with and to bounce ideas off of, and to help us continue to learn even after this year of training. I was really excited to find out I'd matched here. It's a very well-established, world-renowned fellowship that anyone would be, very happy to be a part of. Growing up in a small town, being an athlete, played football, basketball, baseball, pretty much everything. And then going into college, I had kind of a bad injury, posterior sternoclavicular dislocation, which is kind of a rare injury in sports medicine. But that really brought me into contact with our team physician, who was an orthopedic surgeon, and really sparked my interest in medicine, specifically in orthopedics, and probably is what ultimately drove me here today. There's a lot of things that go into making a good doctor. A lot of things most people think about. Certainly there's a skill level and a knowledge level, intellect that takes time to develop. I think what is unique to the Steadman Hawkins Fellowship is training surgeons not just to be skilled craftsmen, but also to interact with patients and develop a personal relationship with them, which is very important to understanding how a disease process affects them, and also what they want to and need to get back to doing in their lives. On my free time, I enjoy staying active, which I think is what drives a lot of us to choose the field of sports medicine. We all have active lifestyles. I think the patient population we see here is very unique. A lot of blue-collar, hardworking people who have a lot of orthopedic problems, and who are really fun to work with, and getting to know them has been a great experience.